I'm the chief medical officer of an organization called Allergy Partners, and we are the largest single specialty allergy and immunology practice in the United States. And we have about 150 board certified allergists who are specialists in allergy, immunology, and asthma care. And we have offices across the United States in 20 states, all the way from New Jersey in the Northeast through the Southeast out to California. And so we're a little unique in that we are a private practice. We're not affiliated with a university or a particular hospital, but have community clinics throughout the country in everywhere from large cities like Chicago, outside of Los Angeles, into very small rural communities like where I am in Western North Carolina. I work a lot of my time is administrative. So I work as our chief medical officer for the entire group. And then I also still see patients as well. So a typical clinic day for me would be seeing patients of all ages. So the great thing about being an allergist in the United States is we see everything from babies to octogenarians, all ages. And we see a variety of different diseases. So the most common being allergic rhinitis, sinusitis, and of course, asthma, which has always been really my passion, is treating patients with asthma. And as you know, many patients with asthma have underlying allergic triggers, particularly in pediatrics. So about 80% of children who have asthma have allergic triggers. So one of the goals that we have as allergists is identify those triggers and allow our patients to manage that as part of their comprehensive care for managing their asthma. One of the things that has always been a struggle is that we have patients, we know that asthma is a chronic inflammatory condition, and that to really manage it for most of our patients, they need to take a daily controller therapy. And the difficulty is that the symptoms of asthma wax and wane over time. So there are days when people feel great, and they're like, well, I feel great. And human nature being human nature is they forget or they don't realize that they should take their controller therapy on a daily basis because like, well, if I don't feel symptoms, I don't need it, right? And so a great struggle has always been how do you keep our patients who have asthma adherent with therapy and take their daily controller? And we know that patients who don't do that on a regular basis are at higher risk for asthma attacks, asthma exacerbations, hospitalizations, et cetera, et cetera. There are many different types of inhalers, and each inhaler has its own technique and version in which patients have to use it. And if the patient is not using it correctly, they're not going to benefit from the medicine. So we have a chronic disease. They need daily therapy, need to take the therapy on a regular basis and do it correctly, but it's very challenging for many patients to do it. And so as the technology has evolved, really looked at how can we leverage this technology to help our patients remember to take their medicine and ensure they're taking it correctly and be able to provide feedback to the clinician to check on their patients to make sure they're doing well. And that's really where the new digital technology comes into play because it allows us to provide patients a very easy, convenient path to have a sensor that fits on their daily inhaler, reminds them to take it, alerts them if they're not taking it by lighting up and beeping at them. And then on the back end, it also provides us as clinicians feedback to make sure our patients are taking it and if they're taking it correctly, because we can have little sensors built in that says, yes, you took in that slow, what I call slow, deep Darth Vader breath to get the medicine deep into the lungs and take it effectively. And then I can work with my patients on the back end to educate and reinforce the need to take the medicine and take it correctly. From a systems perspective, so we're part of a bigger group. So we've got offices in 20 states. We've got about 150 individual clinics that we take care of. Where we looked at is could we find and partner with somebody who had the scale and the technology to partner with us across the company? And then we're fortunate because we have one electronic health record. And so we're able to sort of plug and play each individual location with one solution that will play well with our EMR and allow all of our clinics to be able to offer this to our patients across the country. And as we sort of think about it broader, the broader perspective, at an individual level, yes, we want to improve the care for that individual patient, but the real goal is to also elevate the level of care across populations and be able to demonstrate that by using this technology, not only can we improve care for that individual, but we can also improve care across the health systems and drive down cost. And in the United States in particular, I don't know what it's like in Australia, but healthcare costs are just going through the roof. And if we look at asthma care, the two primary drivers of that cost, one is hospitalizations, emergency room visits, very expensive. And the other are these newer biologic therapies, which have come out for patients with more severe asthma. And that is really driving the cost of asthma care. And by using technology like the Hailie sensor, if we can ensure that our patients are taking their daily inhaler like they're supposed to every day and doing it correctly, we should see that we're going to reduce ER visits, hospitalizations, drive down costs, and I firmly believe will also reduce the utilization of biologics for patients who may not need it if they're taking their controller inhaler regularly. So as an organization, we're looking at it, can we then demonstrate to payers that this type of technology can improve care, reduce cost? And then in our world, then what we would do is enter into different contracts with the private payers where we do risk-based contracting, where we would say, hey, we'll take care of your population of asthmatics and demonstrate to you that we can do cost savings, and then we share in that cost savings between the payer and the practice. So that's sort of the big meta picture of what we're trying to get at, is really improve the care and make it a cost-effective solution for everybody.